Good afternoon, everybody. Thank you for joining us on this rainy day for this month's Adolescent Health Today lecture series. Today's presentation is titled Sports Nutrition for the Adolescent Athlete by our guest speaker, Dr. Troy Smurawa. Remember, you can interact with each other via the online chat room and can send questions for our presenter using the Q&A box. To claim continuing education credit, please remember to return to the portal to complete the necessary steps in the next 48 hours. On the portal, you are able to review your completed courses in the section titled My Transcript. So let me introduce Dr. Smurawa. He is a sports medicine pediatrician and director of the Pediatric Sports Medicine at Children's Health Andrews Institute. Dr. Smurawa also serves as the medical director for the Texas Association of Private and Parochial Schools organization and oversees the medical care for their championship events. He's the team physician for the Prestonwood Christian Academy in Plano, Texas. Dr. Smurawa is a 1987 graduate of the University of Wisconsin and a 1991 graduate of the University of Texas Health Science Center Medical School. He completed his pediatric residency at the University of Wisconsin in 1994 and a fellowship in sports medicine at Akron Children's Hospital Sports Medicine Center in Ohio in 1995. He is certified by the American Board of Pediatrics in both pediatrics and sports medicine. Dr. Smurawa is an active member of the American Academy of Pediatrics, the American Medical Society for Sports Medicine, Pediatric Research in Sports Medicine, and the North American Society for Pediatric Exercise Medicine. He has been a writing contributor for numerous sports and health journals, including Runner's World. As a specialist in pediatric sports medicine, Dr. Smurawa is passionate about helping young athletes overcome injuries and return to the sports and activities they love. He's equally committed to helping them prevent injuries in the first place. Dr. Smurawa is a member of the International Association for Dance Medicine and Science and has developed a strong dance medicine program at the Children's Health Andrews Institute. He is also a member of the International Institute for Race Medicine and USA Triathlon Medicine, and as a certified coach, has developed a running and multi-sport medicine program. With an extremely active family, Dr. Smurawa, his wife Lynette, and three daughters, Noelle, Liesl, and Laurel, enjoy playing sports and being outdoors, hiking, running, and cycling. They also spend time giving back to the community and serve taking regular mission trips together. Dr. Smurawa.
Thank you all for being here this afternoon. My talk today is going to be on the topic of sports nutrition for the adolescent athlete. Now, this is a very comprehensive topic. So my slides are going to be pretty numerous. There's going to be a lot of numbers and details of calculations of recommended amounts of foods and nutrients to take. I'm not going to go into detail with them, but you can have access to the slides afterwards so you can look in detail any specific numbers you want to look at. Also, the last section is more of an educational academic on the role of nutrition, injury recovery, repair, not so much that into clinical application, but I may, based upon time, talk briefly about that, but may not get into all that. And again, a lot of those slides will be available to you after the lecture. Okay, so to begin with, my objectives are basically present the nutritional requirements and guidelines for adolescent athletic performance, and to discuss dietary issues facing adolescent athletes, and as I mentioned, discuss the role of sports nutrition in injury recovery and muscle repair. So sports nutrition for the adolescent athlete. So nutrition for adolescent athletes must meet the demands of growth and development as well as increased physical activity. Proper sports nutrition helps sustain the energy during exercise and also preserves muscle mass and accelerates recovery. Also, we know that the food sources for adolescent athletes to obtain adequate calories should come primarily from fruits and vegetables, whole grain carbohydrates, and lean animal and vegetable proteins. The caloric energy needs for adolescent athletes is different than adults. So the caloric requirements for youth athletes depends on age, gender, and physical activity levels, as well as growth and development. And we know that youth expend approximately 10 to 25% more energy per pound of body mass compared to adults. So their requirement per body mass is higher than adults. So we talk about energy balance. We look at energy intake, and we can see the food pyramid of all the different sources of energy and the proportion of their diet, and then energy expenditure. And the different types of energy expenditure comes not only from exercises, but there's also non-exercise thermogenesis, that's for maintaining body temperature. Actually, you need calories to burn food. And then the main component of our energy need is the resting metabolic rate. That's the energy we need just to live and sustain our body throughout the day. So what are the consequences of low energy intake? So we're going to talk about not only the energy requirements needed for adolescent athletes, but also we need to take in consideration what are the consequences of low energy intake if an adolescent athlete or adolescent is not taking the recommended number of calories. So if that, then with restricted of their low energy intake, they can have loss of muscle mass. Females can have menstrual dysfunction. That loss or failure can lead to increased bone mineral density losses, and increased fatigue, injury, and illness can be a result of low energy intake. And then the recovery can be prolonged because of that low energy intake. So we look at the caloric energy needs for adolescent athletes. So basically, with any person, when we look at the caloric needs, we take their body weight in pounds times 10, and that equals the resting metabolic rate. And that takes in consideration, we also want to take in consideration workout needs. And then we also want to determine daily activity level, whether they're sedentary, moderately active, or very active. And that can be added to their resting metabolic rate. So we look at that with the total caloric needs for a day. The formula is the resting metabolic rate plus the workout needs plus that percent of resting metabolic rate based upon their general daily activity level. Again, these are formulas that you can look at and determine on your own. So in general, if you want to just look at the chart, this is basically an average chart for ages, breaking it down between 4 to 8, 9 to 13, and 14 to 18. And you can look at both males and females, those that are sedentary, moderately active, and active. And you can see the estimated caloric intake that is needed for each day. And this is helpful to understand when you're counseling an athlete on how much calories and how many calories they need per day. So when we talk about food and calorie intake, we're going to break them down into macronutrients and micronutrients. The macronutrients are your basic foods of carbohydrates, proteins, and fats. We'll talk a little bit in detail about each one of those right now. So we look at carbohydrates, protein, and fat, the percentage. So in adolescent athletes, the percentage of calories that come from carbohydrates should be about 45 to 65% of total daily energy. Proteins is about 10 to 30% of dietary energy. And fat, about 25 to 30% of total daily calories, with only no more than 10% coming from saturated fat. Now, this is the fat concentration is higher in adolescents and children because of the need for fat for building proteins, hormones, and other structures used for growth and development that aren't necessarily needed for adults. So we talk about carbohydrates. Carbohydrates are the most important dietary component of young athletes. Adequate amounts of carbohydrates will support intensity training and also promotes rapid recovery. Carbohydrates are the most readily available food source of food energy for the exercising muscle. So they are the primary food sources for high intensity exercise, and they are also exclusive source of energy for the brain and nervous system. So proteins and fats do not cross the blood-brain barrier, so it's only carbohydrates that do that. And so the brain really needs the carbohydrates for energy support. Okay, so talking more about carbohydrates, carbohydrates are primarily stored in muscle and liver as a form of called glycogen. There is a small percentage of carbohydrates that's circulating in the bloodstream, but majority of carbohydrates stored in the muscle and liver. Stored muscle glycogen from carbohydrate consumption pre-exercise helps to delay fatigue during exercise. So we know that if we can increase the stores before activity by consuming carbohydrates, that can delay fatigue during exercise. And I'll talk more about that when we talk about the timing of energy intake of carbohydrates before, during, and after exercise. Carbohydrates consumption during exercise lasting more than 60 minutes helps to maintain blood glucose availability later in exercises. So typically, if somebody's exercising less than 60 minutes, they don't need to take a source of energy of carbohydrates during the exercises. But if they know that they're going to exercise more than 60 minutes, it's important to do that before the 60 minutes, not wait till 60 minutes to prevent them from delayed fatigue. Post-exercise carbohydrate consumption improves muscle glycogen storage, and especially if it's consumed within 30 to 60 minutes after activity. And we'll talk a little bit more about that when we talk about the timing of during an exercise. So why take carbohydrates? Well, as I mentioned, it's the main energy source for muscles. The majority of intake should be from complex carbohydrates, and you should limit the amount of processed foods. So when we talk about the guidelines for how many grams per kilogram today, we can see that there's different levels for recreational versus general training, endurance training, of athletes training a lot longer per day, and then for events lasting more than 60 minutes. So when you reference this, you want to see how much should they take, this should be the reference of how many carbohydrates to take based upon their activity level. So here's just a breakdown of that in a table form based upon light, moderate, high, very high activity in the situation, if it's low intensity to moderate intensity, longer intensity, high intensity. And then it breaks down of carbohydrate per gram per pound versus kilograms. So carbohydrates, again, the duration and intensity of exercise sessions determines the carbohydrate utilization patterns and refueling requirements. So when we talk about when we're looking at and counseling athletes about how much carbohydrates to take before, during, and after exercises, what we want to do is look at what their exercise sessions are, and that can determine the recommendation of how many carbohydrates they should take during that timing period. And here is just another busy kind of table that talks about acute carbohydrate fueling strategies. Just again, general fueling for sports, carbohydrate loading before sports, refueling, refueling before an event, during exercises, and different types of exercises. So this is just basically gives you some different scenarios and what types of fuels and how much carbohydrates to consume for those specific scenarios or activities and situations. So let's move on and talk about proteins. So proteins for adolescents require protein to support general growth and development in addition to enhancing response to exercise training. That's important to know, is that an adolescent is still a growing person, and they need protein for their growth and their lean muscle mass. So during peak growth, increases in lean body mass can reach 2 to 3 grams a day in females and approximately 3.8 grams per day in males. So protein recommendations is needed to maximize whole body net balance after exercises are primarily influenced by total body and fat-free mass. What that means is that when we look at the fat-free mass that the adolescent athlete has, plus what they need to for growth and development, plus exercises, you want to maintain a positive protein balance. So again, sufficient protein intake is needed to replace any lean muscle breakdown from exercise and enhance whole body net protein balance and support normal growth and development. So when we look at this, protein intake should be approximately 0.11 grams per kilogram per hour during and post-exercise recovery, or we talk about 1.5 grams per kilogram per day for the whole day. And if you break it down to 5 meals, that's 0.3 grams of protein per kilogram per meal 5 times a day. Again, that's busy numbers, something that you can refer to when you're counseling and figuring out the amount of protein an adolescent athlete needs. So protein intake is usually easily met by a typical mixed diet. So vegetarians or vegans or energy restricted athletes should be assessed to ensure that their protein needs are met, because they could have restrictions and not get all the recommended and required amino acids and proteins required for their growth and development or activity. Non-meat protein sources include legumes, nuts, seeds, milk, yogurt, soy, and eggs. So that's important to do if you have a vegetarian or vegan or an athlete, that there are other sources of protein other than meat. More protein intake is needed to gain muscle, but an individual must also be taking in more calories than expended. Otherwise, they will not get any weight or muscle gain will not occur. So that means if they're taking the right amount of protein, but they're caloric restricted, that extra protein will not go to muscle gain, but will go to caloric needs, and they won't gain the proteins that they need for muscle building and muscle bulk. And we talk about consuming protein should be 3 to 5 times per day in about 20 to 30 gram doses, provides the right amount of multiple stimuli to maintain and build lean muscle mass. So it's important that adolescent athletes, because their growth and requirements aren't restricting the number of meals, but actually improving the number of meals. So 2 to 3 meals a day is not is less than what's needed. They need at least 3, if not to 5 meals a day with their protein and carbohydrates spread out through the day. And then protein and nutrients are delivered to the muscle and cells quicker in the immediate post-exercise period. And we'll talk about that, of what to do in the post-exercise recovery period in regards to carbohydrates, proteins, and with it. And then protein combined with carbohydrates post-exercise will help prevent further muscle breakdown and activate muscle repair. So the combination of protein and carbohydrates is a very good and appropriate source of combination for athletes immediately post-exercise, and that helps maintain recovery, repair, and develops their strength and improves their muscle mass and lean muscle mass, and improves performance after exercise. So with protein, this is the typical recommended daily allowance for adults, 14 to 18-year-olds, and 4 to 13-year-olds. And we talk about resistant athletes versus endurance athletes. The resistant athletes, especially males, may require a higher amount of protein per day than normal athletes or non-resistant athletes. So we talk about protein again. Why do we need protein? It's primarily for adolescent athletes for muscle growth and repair. We also need it for red blood cell production. And as I mentioned before, proteins and amino acids are a key product of hormones and enzymes that are needed to aid in metabolism regulation, but also for those hormones and enzymes that are needed for adolescent and youth growth and development. And you want to have high quality proteins that provide those amino acids that are essential for those specific metabolic processes or development of hormones and enzymes. And again, the guidelines here are recreational athletes versus endurance and strength athletes and teenagers. Again, teenagers do need a higher amount of daily proteins because of that growth, development, enzymes, and hormones that are developing during that growth period. So here again is just another table of the type of athlete, the level of athleticism, and how many grams of protein per pound body weight they need per day. And then it talks about the daily protein requirements for basically if you take a 150-pound athlete, what that would look like on the average. A little bit less for smaller athletes, a little bit more for larger athletes. So now let's talk about fats. So fats, you need an adequate dietary fat intake to meet the requirements for fat-soluble vitamins such as A, D, E, and K, the essential fatty acids, as well as hormones, especially sex hormones. And those are very important in an adolescent athlete because they're going through puberty and they require that development of those hormones and need those essential fatty acids. Also, dietary fat helps provide energy to support growth and maturation. Evidence suggests that maximal fat oxidation rate relative to lean mass appears slightly higher in athletes younger than 8 years old, which means is that adolescent athletes burn fat more efficiently and more readily than adult athletes. And again, children and adolescent athletes, relative adults, will rely more on fat than carbohydrates as an energy source. So the guidelines for adolescent athletes, as I mentioned before, are a little bit higher. So it should be 20 to 35% of total energy, with no more than 10% coming from saturated trans fatty acids. Good sources of fat include lean meat and poultry, fish, nuts and seeds, dairy products, and olive and canola oil, which are lower in saturated fatty acids. Again, why do we need fats? It's a good energy source. It is also important for nervous system health. Also, it delivers an absorption of fat-soluble vitamins, which are very important for health. We want to limit saturated fats, and we want to include omega-6 and omega-3 fatty acids, which are very important components for growth and development, and for enzymes and hormone development. And again, the guidelines are to limit saturated fats to 10% of total fat intake, and the amount typically is about 1 gram per kilogram per day of fat. Again, with athletes, you want to stress to athletes it's important because some athletes may assume that if I eat too many fats, that I'm going to gain too much weight and it's not going to provide the calories for me. So they're going to be very restrictive, which actually may be counterproductive to their growth and development and their athletic development. So athletes, you want to stress that it's important that fats do protect vital organs. It does provide thermal insulation, and it is a vitamin carrier. And you want to recommend heart-healthy fats, so the essential fatty acids that have omega-3 fatty acids and unsaturated fats. Diets with less than 50% fats are harmful to health and performance. You want to really let that parents and athletes know that really restricting fats in your diet is not healthy. And we talk about minimum body fat for females. Percent body fat should be no less than 14%, and males no less than 7%. Anything below that is unhealthy and could affect their health and performance in the long term. Okay, so now I want to move on to what's called fueling for exercises and the timing of different components. So we break down the timing into 3 periods: pre-exercise, during exercise, and post-exercises. So I'm going to talk about the 3 components for both carbohydrates and protein, the timing of that, as well as other nutrients. So in pre-exercises, you want to look at the goal of the pre-exercise nutrition and meal, the composition, and the timing of that. So the goal of pre-exercise meal is to prevent hypoglycemia, settle the stomach, stop hunger, fuel the muscles, and also to help psychologically as far as preparing for their activity. And you want to fill up with carbohydrate and protein to increase energy source, and not just carbohydrate, both that carbohydrate and protein combination. You also want to make sure they work on hydrating with fluids, because you want to be topped up with fluids and not be dehydrated or low in hydration when you get into exercises. And usually we talk about athletes 30 to 60 minutes before exercise. You want to basically have a light snack or some fluid to top off that muscle glycogen before exercise. The composition, so the pre-exercise meal should contain sufficient fluids to absorb the pre-competition meal. It should also be low in fat and fiber. It should be high in carbohydrates, both simple and complex carbohydrates, not just the simple sugars and complex. It should also have moderate protein, which is approximately about 20 to 30 grams, or about 10 to 25% of the calories from a protein. You want to use familiar foods. You don't want to introduce unfamiliar foods prior to an exercise or competition. And fluids should be anywhere between the area of 16 to 24 ounces, depending upon the activity, the body size of that person. And I always tell people, if they have a rich meal the night before, then they should have a small early morning meal if their exercise is earlier in the day, early afternoon. And some suggestions for that are like a bagel, cereal, bananas, fat-free yogurt, shakes such as Boost. Those are things that can provide a good pre-exercise meal. So the timing, this is pretty busy, but we kind of break the timing down in 2 to 4 hours before exercises, 1 to 2 hours before exercises, and 30 to 60 minutes before exercises. So the 2 to 4 hours, you want to eat a normal meal 3 to 4 hours before exercise with about 400 kilocalories. A small snack 1 to 2 hours with about 200 kilocalories. And then 30 to 60 minutes, you just want to have a small amount of to top off muscle glycogen and hydration. So simple carbohydrates and simple sip fluids, 30 to 60 minutes are appropriate for that pre-exercise meal. Now let's talk about what we want to do during exercise. Again, we'll talk about the goals of the food and intake during exercise, the composition, and the timing. So the goal of fuel intake during exercises is to sustain energy levels and maximize performance. As I mentioned before, events under an hour, water is all that is needed. But events over an hour, then you want to have carbohydrate consumption to help maintain blood glucose levels when those glycogen stores are starting to diminish or replenish. And typically, we recommend 30 to 60 grams of carbs per hour, either as food or as in a liquid form. It all depends upon the type of exercise they're doing, whether it's better to take it in a liquid form or in a fuel form. Again, if they're going to start doing it do exercise that they know ahead of time that it's going to be over 60 minutes, they shouldn't wait 60 minutes to start consuming carbohydrates. They should start consuming it right away so that when they get to that 60 plus minutes, they already have started to replenish some of the stores that are going to start to get depleted over that period of time. So the composition, so sports drinks should contain both carbohydrates and electrolytes. They should contain 6 to 8% carbohydrates. Anything more, that's going to start to upset the stomach and not be absorbed as adequately. You can also, we talk about eating a banana, which has 28 grams with a gulp of a sports drink, or sports bar has 45 to 50 grams of carbohydrates. And there are energy gels to drink with water that also can provide some easily absorbable carbohydrates during exercise. Timing, so basically we recommended that they take 6 to 12 ounces of a sports drink containing 6 to 8% carbohydrates every 15 to 20 minutes during exercise. And that should be sufficient enough to replenish their carbohydrate stores that they're losing during exercise if they had an adequate pre-exercise meal and they're not depleted when they start the exercise. So when we talk about post-exercise fueling, we're going to talk about the goal, composition, and timing. So the goal of the post-exercise meal is to refuel with carbohydrates to replenish muscle glycogen. We also want to repair with protein by taking protein post-exercises. They're going to inhibit protein breakdown and stimulate protein synthesis, which helps with muscle repair. We also want athletes to rehydrate with fluids and electrolytes in that post-exercise period. And this post-exercise period refueling will assist in recovery for back-to-back or daily workouts. So if somebody is working multiple times during the day, that will help with them. If they're working consecutive days, that will help recover with their exercises so that when they start their next exercise session, regardless if it's that day or the next day, their fuels are all replenished and ready to go for the next session and not being depleted in that state. So the composition of the post-exercise meal, excuse me, post-exercise snacks and meals should contain both carbohydrates and protein. We recommend consuming high carbohydrate-rich foods and drinks. So that's going to give those exercising muscles and cells a easily absorbable source of carbohydrates. And the addition of protein of approximately 20 to 30 grams also is helpful because that will again stimulate muscle repair that has that adequate protein that's there, that's easily available for those muscles to start to repair any muscle tissue that's been breaking down. So sports drinks and fruit, flavored milk, and graham crackers, drinkable yogurt, pretzels, dry seal, trail mix are good post-exercise meals. And it's also been shown that chocolate milk is an excellent post-exercise recovery drink because it provides both the protein that's easily absorbable and readily available for the muscles, and also provide the carbohydrates that are required for that post-exercise meal. And the timing, again, consuming a meal or a snack within 30 to 60 minutes post-exercises has been shown to allow them to readily absorb those nutrients into the system. Muscles after exercise are primed for energy and glycogen uptake. So the body is easily to take that up after an hour, then that process slows down. These are the recommended recommendations of the amount of calories to take, both carbohydrate and protein immediately in that 36-minute post-exercise. And then usually within a couple of hours, you want to add a snack or meal with 1.5 grams per kilograms about 2 hours later, and that will help top off and provide any more calories that they need that to support that exercise that they just underwent. So hydration, oftentimes hydration is not talked about in nutrition because people don't view fluid as a nutrient, but it is very important to nutrients. So it is an essential part of the nutrition plan. And thirst is not an indicator for hydration. You really need to have a plan and prepare ahead of time. Generally, you want athletes to drink throughout the day, and that can be for milk, juices, herbal teas, sport drinks, and plain water. That will help them replenish and provide them adequate daily hydration. And there are some guidelines prior to exercise, during exercise, and after exercise. But basically, 2 hours prior to activity, you want to drink about 16 ounces, and in 15 minutes, drink something additional ounces. And during activity, it's usually 4 to 6 ounces every 10 to 20 minutes during activity. And then post-activity, drinking about 24 ounces per pound of weight loss. And then the sweat rate is also important because that is a good indicator of fluid losses. So if you're a heavy sweater, training, practicing, doing exercise in a hotter environment, you're actually going to lose more sweat and lose more fluid. So your fluid requirements are going to be higher. Why is hydration important? Well, fluids help regulate body temperature and replace sweat losses during exercises. The environment and temperature and humidity does affect sweat rates and the requirement for fluid intakes. As I mentioned, higher and more temperature and higher humidity temperatures are going to require more fluids because that athlete is going to sweat more during that time. And as I mentioned, proper hydration requires fluid intake before, during, and after exercises. And the amount of fluid required depends upon many factors, including age, body size, the duration of the activity, the temperature, the ambient temperature, the amount of sweating. We talk about adolescents. So adolescents and children have a similar capacity to adults to deal with thermal loads and exercise tolerance time during exercise and heat. Sometimes it's a misnomer that children and adolescents cannot handle the heat. They can handle the heat. A little bit different. So their mechanism for heat dissipation in adolescent children is a little bit different than adults. They rely upon more on peripheral blood redistribution. So they're distributing more blood flow to the extremity because their body surface area is higher. So they rely on more radiative and conductive cooling rather than sweating or evaporative cooling. Adolescents who train regularly will adapt by enhancing peripheral vasodilation, which improves non-evaporating cooling, whereas adults rely more upon evaporative sweating. Adolescents will transition to adult mechanisms, but not until puberty is complete. So in those adolescents that are still going through puberty, they're still going to rely upon peripheral blood redistribution rather than cooling through evaporation through sweat. So we want to make sure that adolescents and athletes know the effects of dehydration on performance. So if you're dehydrated as an athlete, it can impair cardiovascular function, which is very important for athletic performance. It can also affect muscle metabolic function. So muscles fatigue, cramp earlier if they're not having enough hydration. It also can, dehydration can affect cognitive performance. It can also put effect on motivation. And we know that it does affect muscle strength at a higher level. So dehydration can reduce muscle strength. And actually, dehydration can contribute to hyperthermia and heat illnesses such as heat stroke and heat illness. And any 3 to 5% dehydration, that it puts an athlete at a higher risk for any type of heat illness, especially heat stroke, which is life-threatening. And especially in states in the South like Texas, where in the summertime and fall, the heat index is still high and the risk of heat illness and heat stroke is very prominent. So here's just a busy slide. It talks about hydration for optimal performance. It tells you how much you take pre-exercise, during exercise, and post-exercise. And obviously, your body size, whether you're an adult or a child, the length of your exercise depends upon how much you take. This is kind of just a breakdown of what to take as far as different amounts of hydration during exercise, and then making sure they're pre-hydrated and post-hydration to make sure that they're consuming the right amount of fluids. This is just basically another table. It talks about hydration guidelines before, during, after training. If you want to break down simple, how many ounces, 2 to 3 hours before, 15, 30 minutes before, during activity, and after activity. A pretty simple table of the amount of fluids that's required for an athlete training in exercising. And this is just breaking it down if you were looking at the body weight in kilograms, the fluid replacement during exercises, milliliters per hour, and the fluid replacement after exercise. Just gives you a generic for this based upon a 13 milliliter kilogram during exercise and 4 milliliters per kilogram after exercise is kind of the general rule of thumb, and that may vary from person to person and athlete to athlete. So as I mentioned before, for events lasting longer than 60 minutes or taking place in a hot, humid weather, then we want to make sure that athletes are including carbohydrates and electrolytes in their fluids. So if they know that they're going to be exercising longer than 30 minutes, or even if it's under 60 minutes and it's very hot and humid, then they should have a sports drink that contains 60% carbohydrates and 20 to 30 milliequivalents a liter of sodium chloride, which is normal saline, basically. So as I mentioned before, post-exercise rehydration is very important. And the goal is to replace sweat losses. And typically, you want to replace 1.5 liters of fluid for every kilogram of body weight lost. So this consumption of sodium-containing fluids and snacks after exercise helps with rehydration by stimulating thirst and fluid retention. So having some food also stimulates thirst. That also stimulates them to drink more, and also that extra sodium and food intake pulls more fluid into the body as they absorb it into the gut. Here's just an example of hydration calculation using pre and post workout weights. So it's just a formula: pre-weight minus the post-weight times 20 ounces per pound. That tells you the ounces of fluid to replace. So it gives you an example of a 130-pound person who loses 2 pounds. They need 40 ounces of fluid. And you want to, again, this is kind of one goal is to replace 80% during the first hour, and then afterwards continue to replace it. And then it talks about how to replace it every 15 minutes afterwards. This is just, these are not, hard and cut and dry. These are just guidelines of things to realize, to emphasize that they really need to replace these fluids post-exercise so that does not impair their performance and recovery. So now I want to go ahead and talk about micronutrients. So micronutrients are things like vitamin and minerals. And then the three most important ones, I think, for adolescent athletes are iron, calcium, and vitamin D. So vitamins and micronutrients are very important because iron, calcium, and B vitamins are essential in maintaining health of an athlete. Many high school and college athletes have been shown to be deficient in these areas, and it's probably due to the poor diet that high school and college athletes consume on a daily basis. And in the short term, it hampers athletic performance. In the long term, it can affect overall health issues. So with iron, these are just general rules that an average 15 to 18 milligrams of elemental iron per day for most adolescent and college athletes. Calcium, anywhere between 1,300 and 50 milligrams per day. And vitamin B vitamins is basically what is the daily recommended amount is what is needed for these young athletes. So I'm going to talk about iron deficiency in the adolescent athlete, because this is probably one of the most prevalent micronutrient that is deficient in adolescent athletes. And what are the causes of iron deficiency in the athletes? There's multiple causes. Mostly it can be poor intake. That's probably the most common reason, is that these adolescent athletes do not have an adequate dietary intake of iron. Restricted diets is the primary cause of that poor intake. GI blood losses, in some cases, they may have some unknown gastrointestinal blood losses that they don't see. Iron loss, it occurs through sweat. It's very nominal, so it's not a major loss of iron in sweat, but it is a source. Foot strike hemolysis is basically in runners or repetitive athletes. There is that potential that when there's repetitive striking of the feet, the blood cells flowing through the capillaries in the feet can be compressed and causes red blood cell hemolysis, which creates a loss of blood and iron. And then in female athletes, there is a concern of menstrual losses, and it depends upon the individual female, how much blood they lose each month and the length of that. So when we talk about iron deficiency effects on athletic performance, and we want to emphasize this to athletes, that iron deficiency does have an effect, or detrimental effect, on athletic performance, because it can actually potentially decrease the VO2 max. So especially in endurance athletes, that is a major effect. It can alter metabolic rate. So it can affect the body's ability to metabolize foods and provide energy to exercise and muscles. It can sometimes cause an alteration in thyroid hormone status. It can affect thermal regulation. It can also affect psychomotor development. And in some cases, it can also impair immune function. When we talk about the degree of iron deficiency, we can look at different stages of iron deficiency. We call it depleted iron stores, early functional iron deficiency, and then iron deficiency anemia. I think the biggest mistake I see healthcare providers is they will do a CBC and get a hemoglobin hematocrit, and okay, their hemoglobin hematocrit are normal, so they're not iron deficient, so there shouldn't be any issues with iron deficiency. But actually what we look at is we want to look at iron stores and the effects of that on early erythropoiesis and red blood cell production. So we talk about depleted iron stores, and we look at serum ferrin, hemoglobin, and transferrin saturation. So these are three areas that we can actually look. So early on, if we see that the serum ferritin is low, even though the hemoglobin and the transferrin is high, that they may be entering into a depleted iron store state. And as we go and see that the serum ferritin is low, and the hemoglobin is still normal, and the transferrin is low, we're in that early functional iron deficiency. And then the iron deficient anemia state is when all three are low. And hopefully you can monitor and detect those earlier states and prevent the iron deficient state. But unfortunately, oftentimes you will see athletes that have already progressed to that iron deficiency anemia state. So when we talk about screening, mainly hemoglobin and ferritin, and you can use transferrin, but I usually stick with the hemoglobin and ferritin levels. And typically I'll start treating if the ferritin level is below 40 nanograms per milliliter. And those athletes that are at high risk are vegetarian athletes, runners, and female athletes. So it tends to be the higher risk athletes for iron deficiency. When we talk about iron deficiency, we talk about solutions to treat and avoid iron deficiency. We know that that increasing vitamin C intake with non-heme iron helps with the intake, increases levels of heme iron with iron-rich foods such as red meat, dark poultry. Iron supplementation is a source, and sometimes oral contraceptive use can be used to control dysmenorrhea or abnormal menses bleeding to prevent that excessive blood loss if they have dysfunctional or abnormal uterine bleeding with their menses. I know this is a busy slide about iron deficiency anemia, but just some base things is that it is common to supplement with iron for the pharmacological treatments for iron deficiency. Ferrous sulfate is the most readily available form. You want to use any type of source that has over 300 milligrams a day of the ferrous sulfate, or over 60 milligrams of elemental iron. You want to make sure you're not giving too much, because that can be associated with nausea and constipation. And we talk about you want to do enough to maintain sufficient ferritin level. So usually most athletes that are non-deficient can take 125 milligrams a day of ferrous sulfate or 39 milligrams of elemental iron and not overdose on iron. Ascorbic acid or vitamin C, 250 to 500 milligrams a day is very helpful. And then it takes 3 months to replete iron. It may sometimes take up to 6 to 12 months in some patients if they're significantly depleted. And you want to follow up testing to monitor their replenishment and their maintenance of the iron stores. And there really is no current standard of policy for screening and treatment of iron deficient athletes that has been developed. So you have to kind of go by the guidelines of what works best for each of your athletes. Dr. Randy Eichner is a sports hematologist, and here's his recommendations that if you have serum ferritin levels above 40 nanograms, no treatment. If it's between 20 and 40, 27 milligrams of elemental iron. And if it's below 20 milligrams, it's 225 milligrams of ferrous sulfate, which is basically somewhere around 60 milligrams of elemental iron. And you want to have them take 100 tablets and follow them after take 100 tablets. This is just, so we talk about calcium and vitamin D. Calcium and vitamin D is another micronutrient that is oftentimes deficient in adolescent athletes. If you look here, you can see the recommended daily allowance anywhere between 13 milligrams a day to 50 milligrams a day for adolescents for calcium, and vitamin D, it's usually the 400 to 600 international units a day. The upper limit is 4,000. So people can take up to 4,000 a day without concern of taking too much, but usually 400 to 600, and I usually recommend 1,000 international units a day as a daily intake unless they are deficient. So calcium is essential for bone growth, bone mass, as well as nerve impulses and muscle contraction. It's very important for the growing adolescent because their bone mass is continuing to grow. Dairy products and non-dairy products are the main source of calcium in a typical diet. Less than 15% of female athletes between the ages of 9 to 18-year-olds meet the recommended calcium intake. So it's important that you counsel your adolescent female athletes on the amount of calcium they're taking and let them know how much calcium they need to take. Female athletes have a decreased risk for stress fractures if they're taking over 1,500 milligrams a day of calcium. And calcium supplements are not a good substitute for dietary calcium in regards to impacting bone health, but should be considered if dietary needs are unable to meet with food. And oftentimes, when you talk to an adolescent female athlete, you know that they're not going to take the amount of calcium in by drinking milk and taking dairy. You have to kind of just counsel them on the amount of supplements they can do with that. So we talk about calcium and a decrease a number of intake. So you can decrease stress fractures of calcium levels above 50 milligrams a day. That's important to assess. And this has been shown in military recruits or female military recruits. If they're taking 2,000 milligrams of calcium a day and 800 international of vitamin D in over 8-week trial, they reduce the incidence of stress fractures by 20%. And that's very important. That's very impactful and important for female adolescent athletes and young college athletes to know. So calcium supplementation, calcium citrate, calcium carbonates, fortified beverages are good sources. And they should be ingested in doses of 500 milligrams or less. So you don't want to take it all at once. You want to take it throughout the day. Vitamin D. So basically, you're looking at the cutoff of values. So usually, even though I think the lab normal is 20 or above, but in adolescent and athletes, we use 30 as a cutoff or 70 nanomoles per liter. And so the current recommendations are 600 units a day for 14 to 18-year-olds, but you can go up to 1,000 safely. Anything over that is something you want to use if you are treating deficient vitamin D levels, but you want to monitor them. And those that are increased risk of vitamin D deficiency are athletes who live in the north, athletes who train indoors, gymnasts, basketball players. So all these different athletes are at higher risk. And sources of vitamin D, sun is the main source, but also in fortified fruits and vegetables and cereals, and fatty fish also is a good source for vitamin D. It's also helpful for calcium absorption, immune modulation, and inflammatory modulation. And again, if it's really deficient, you can go up to 50,000 units for 8 weeks and then recheck after 8 weeks. And then you can continue if it's high, if it's normal, then you start to get back down to the maintenance level of 1,000 to 2,000 units a day. The next thing I want to talk about is dietary issues facing the adolescent athlete. So basically, we're talking about body image issues and bad diets. So basically, adolescent athletes frequently feel the pressure to maintain or lose weight to improve performance. Also, adolescent athletes frequently feel the pressure to maintain or lose weight to achieve a certain body image. And this is higher in those athletes, like the female athletes that have our aesthetic component, like gymnastics, dance, figure skating, cheerleading. Those are different sports that are higher risk. And these dietary pressures can lead to unhealthy diet practices, which conversely negatively affect performance and an unhealthy body image. So pressure to maintain or lose weight can lead to eating disorders, stress fractures, leg pain, lack of a balanced diet, looking for the magic potion, and use of supplements instead of whole foods, which is unhealthy overall as a healthy diet. So and I'm looking at this basically leads athletes to go to these fad diets. And many fad diets claim the benefit of improved athletic performance, but are not shown that way. And these are unsubstantiated or have actually unhealthy merits. So diets that are restrictive or exclusive are at risk of not meeting nutritional guidance for general health and sports. Common fad diets are the low carbohydrate, high fat ketogenic diets, paleo diets, which is a caveman diet, gluten-free diets, and intermittent fasting. So these, I won't go into detail about these, but these are very unhealthy diets and that should not be encouraged. Healthy weight gain, it's important to encourage that in adolescent athletes that want to gain weight healthily. And these are some things they want to do: build muscle mass and lean tissue. It talks about avoiding empty calories, eating 3 meals a day and 2 snacks. We talk about 5 meals a day, utilizing high energy foods and complex carbohydrates and good fats, limit high fiber bulky foods, and making sure the meals are carbohydrate and protein supplements versus just all carbohydrates or all protein. The next thing is dietary supplementation for nutritional ergogenic aids. So the key thing is that the judicious use of specific dietary supplementation and nutritional ergogenic aids may improve sporting performance in adults. However, most but not all products are yet to have shown their effectiveness and long-term safety rigorously explored in young athletes. So therefore, despite the positive scientific evidence, the prevalence of supplement use among U.S. children and adolescents and performance hazards is about 1.6%, which is very low, but it is still a significant amount of use, and it's really not scientifically proven. Some commonly identified popular sports supplements used by adolescent athletes include vitamin and mineral supplements, sports protein powders, vitamin waters, creatine, caffeine, and anabolic steroids or steroid precursors. And some of the reasons for adolescent athletes to take performance-enhancing dietary supplements include the pressure to achieve competitive results, to improve strength gains, the pursuit of physical ideals, peer, social, and marketing pressures. So what is the role of parents, coaches, and healthcare providers? Well, it is considered inappropriate for young athletes to be encouraged to consume dietary supplements for performance enhancement. This excludes the clinical use of dietary supplements like calcium, vitamin D, and iron, and B vitamins when they're under the guidance of a qualified health professional, as we talked earlier on in the talk. The focus should be on improving performance through maturation, sports experience, proper training, nutrition, and rest regimen, and avoid these quick fix nutrient supplements and ergogenic aids. And you want to prioritize prudent training, whole food-based nutrient practices versus these quick fix or supplements that people think are going to take the place of a good meal. Okay, so the last area is sports nutrition for injury recovery and muscle repair. And we're not going to get through everything, but I just want to briefly go over a few things. Is that there are musculoskeletal injury types. There's the exercise-induced muscle damage. There's our overuse tendinopathy, stress fractures, and traumatic injury. When we talk about exercise-induced muscle damage, we talk about mechanical muscle damage, metabolic muscle damage, and inflammatory responses. So mechanical muscle damage is basically mechanical damage that's due to stress and overloading myofibrils and causes intramuscular breakdown. Okay. If it continues, it can cause tissue ischemia and hypoxia and breakdown of muscle enzymes. And if it goes way beyond simple breakdown, it can create an increase in creatine kinase, myoglobin, and lactic acid. And this is where we go from cramping all the way up to we talk about exertional rhabdomyolysis, where too much tissue is broken down from exertion, and it can progress into a significant event called exertional rhabdomyolysis, which will cause significant muscle tissue damage and cramping and difficulty with muscle function. The inflammatory response is basically is a breakdown of muscle tissue, and it releases cortisol and epinephrine and oxidative stress on the tissues. And these are things that can cause muscle damage and need to be addressed in things that can occur with muscle damage. So these are some of the things that can occur in an athlete with excessive muscle breakdown. You can have decrease in physical performance, increased lactic acid production. They can affect the heart rate response to submaximal exercise. It can increase insulin resistance, prolonged glycogen depletion. It can increase metabolic rate at rest and exercise, and can create delayed onset muscle soreness. Again, we talk about tissue damage and medical response. It causes an increase in insulin release, increased protein synthesis. And these are just effects of increased insulin release. It has an anabolic effect. It breaks down protein, it increases the rate of protein synthesis, and it affects protein and tissue repair. And we know that carbohydrates can stimulate the increased insulin response as well. Increased protein synthesis is basically you need more protein activation with amino acids. So that's why providing amino acids and protein post-exercises will increase protein synthesis and decrease muscle damage long-term after a exercise session. And then here are some of the nutritional supplements for injury recovery. So the macronutrients that we talked before, carbohydrates and protein, particularly the carbohydrate-protein combination. Micronutrients such as antioxidants and fatty acids have been shown to help with repair. So protein and carbohydrates produces an anabolic hormonal response to endurance and resistant exercise, which promotes muscle build and repair. It reduces the rise in cortisol and epinephrine, which is counteractive to muscle building and repair. It elevates insulin during exercise, which increases the amount of muscle tissue intake of carbohydrates. It also elevates insulin and growth hormone post-exercises, which promotes tissue, muscle and tissue repair. And it decreases muscle protein breakdown and stimulates muscle protein synthesis in the protein post-exercise period. Again, young athletes should consume a post-exercise snack high in carbohydrates with moderate protein within 30 to 60 minutes of finishing exercise to restore muscle glycogen and stimulate that initiation of muscle fiber and protein repair and building. Antioxidant supplementation has been shown to have some help. So vitamin C, vitamin E, carotenoids, and polyphenols have been shown to help. So it affects muscle injury recovery. It reduces oxidative stress on the muscle. It can attenuate, it can slow down muscle damage and soreness. It does have efficacy. There's some areas that may not show that, but for the most part, it does show efficacy. And the timing of taking it report in regards to exercise does help. So if it's taken afterwards, it helps. Also, it seems to help more with resistant exercising than with endurance exercises. So briefly, vitamin C is helpful in that role. Vitamin E also helps reduce oxidative stress and decreases the creatine kinase response to exercises. And oxidant supplementation with vitamin C and E has a synergistic effect, and they are safe to take with athletes post-exercise. And things like vitamin A, vitamin B6, selenium, and zinc also have been shown to have some benefit in post-exercise recovery and preventing tissue breakdown and repair. Fatty acids also are helpful. It helps reduce recovery by reducing inflammation. And you can see the different types of fatty acids that have been shown. So you can actually get supplements that have these specific fatty acids in it. Fatty fish is helpful, as well as plant oils, walnuts, flaxseed, canola oils as well. And soybean oils is helpful. Okay, well, I did get through everything that I had to present in regards to the topic of sports nutrition for the adolescent athlete. It's a very comprehensive overview of sports nutrition, but again, if you have any questions, I can take them, and I will have those slides available for you to go over them in more detail on your own.
Thank you, Dr. Smurawa, for our very informative presentation. There is one question that we have.
Yep.
Someone's asked, there's an increased risk of cardiovascular disease, which has been associated with calcium supplements. They would just want you to comment on that.
So the thought is that if you have too high of a calcium intake in your diet, that can somehow can affect muscle tissue, including skeletal muscle as well as cardiac muscle, and that can have some effect on. Also, this is probably more so for older athletes, that excessive calcium can be associated with plaque formation in the coronary artery. So for an adolescent athlete, probably not anything to worry about. I don't think most adolescent athletes are going to overconsume the calcium in their diet.
Great. Okay. Since it is top of the hour, so I want to be respectful to our audience. Just want to let everybody know that the next Adolescent Health Today lecture series presentation will be on Monday, March 11th. And again, thank you, Dr. Smurawa, for such an informative talk.